Why I am not conceiving is a question which arises in many women who have been trying for a baby and not happening on time. When do you actually call it as infertility? Infertility is when a couple has been trying for nearly a year without any contraception and not being able to get pregnant. But what happens in most couples? When a couple tries for a pregnancy, nearly 30% conceive within the first month of trying, and another 60% conceive within 3 months. And it takes nearly 1 year for 80% of the couples to conceive, and another 5 to 10% conceive within 2 years' time. So that means most couples on their own conceive within 6 months. And when there is a delay, there could be a little longer time for a pregnancy to happen. But don't get disappointed. It's not necessary for every couple to start planning for a treatment soon after 1 year, because there are quite a few or quite a number of couples who may conceive even if you wait for 2 years' time. And one should not feel rushed to go into a treatment. So when should you actually start, and what are the factors which can influence a delay or for happening of a pregnancy? Age is the most important factor for both men and women. For women, age is very, very important, because with time the number of eggs become lesser and the quality also becomes lesser and lesser. Normally, the best conception chances are for a woman between the age of 21 and 27. From 30 onwards, the pregnancy rates decline, and from 37 to 38, the success rates are almost half down, and from 40 age, the chances are much lower. In the same way, men over 45 are considered as advanced paternal age. There could be a lowering of the sperm quality, and at the same time, there could be an increase in the genetic anomalies in the child with an increased paternal age also. So age is a very important factor for both men and women. And also equally important is the health of the couple, their family history and their medical history also. So when should a couple start planning for a pregnancy or start planning for a treatment? Suppose a couple have been trying for a year or so, and if they are less than 35, they can start looking for consulting a physician or starting some treatment. If they are over 40 or over 35, they should start treatment or start consultation from 6 months of trying. But what are the causes and why there is a delay in the pregnancy? Is it just a woman's fault? No. Men are equally responsible for delay in the conception. In 30 to 40%, the reason for delay is because of abnormality in the sperm count or the semen volume, or because of the motility. So the fault lies in about 30 to 40% of men for a pregnancy not happening. And in 30% to 40%, the woman could be responsible. And in 10%, it is unexplained. So that means both husband and wife are completely normal and still a pregnancy does not happen. So what are the reasons for a pregnancy not happening in a woman? It could be an ovulation problem, which is the most common problem for most women. Either it could be because of problems like polycystic ovarian disease, or also another problem where there could be insufficient number of eggs in the ovaries, or most have been used up, so that the quality of the eggs is lesser, and then the pregnancy rates also becomes lesser. There could be a tubal blockage because of pelvic infection. It could be because of endometriosis, fibroid uterus, and also there could be a cervical factor. So all this could cause a delay in a conception. A tubal factor is a reason in about 25% of women. And in men, it could be a lowering of the sperm count, or it could be the lowering of the motility. But remember, 10% has unexplained infertility, where everything is normal. So, should you really see a doctor? If you are worried and if you are in a rush and if you think that your age is going up, then maybe it's always better to consult a doctor so that you can at least know the tips and tricks of having conception, even trying when you're planning for a natural pregnancy. And also you can do some basic tests to know if there is any cause for a delay in the conception. So the main basic tests which are required for a couple when they see a physician is that importantly it's the first semen analysis. So about the count and the motility, and once it is normal, the woman can go through the rest of the tests. One of the most important tests is to check whether she is ovulating on time. The other test is whether there is enough number of egg count in the ovaries. And the tubal factor, the test is actually a little more invasive and maybe it can be done at a little later date after trying with some simple treatments. So if you find that woman is having irregular cycles, she is ovulating normally, the egg count is normal from the basic test, and the man has a normal sperm count and motility, maybe there is no hurry for us to rush into the treatments. Maybe you can wait for a couple of more months and try naturally and more confidently. And you never know, you may not have to come back for a treatment at all and you may conceive on your own.